Hi everyone, and welcome to today's informational session titled ASM Foundation 2024 Community Sleep Health Grant and Public Awareness Grant Overview and Lifecycle, hosted by the American Academy of Sleep Medicine Foundation. This webinar will provide an overview of the ASM Foundation's Community Sleep Health and Public Awareness Grant from submitting a competitive application all the way through grant closeout. My name is Vanessa Gonzalez, and I'm the Director of Grant Programs for the ASM Foundation, and I will be leading today's webinar along with our Grant Programs Coordinator, Sarah Phones. Before we get started, I'd like to remind you that your audio is muted and your video is off. We do encourage you to include any questions that you may have throughout the session on this grant program in the Q&A portion of the Zoom platform, and we'll reserve the last 15 minutes to go through those questions. Additionally, a recording of the webinar will be emailed to all attendees and available on the ASM Foundation website. So before we start, let's introduce our two speakers, which include myself. Like I mentioned earlier, I am the Director of Grant Programs, and I oversee all of our grant programs, and I implement grant making best practices, and I work on several initiatives to increase funding for high priority sleep research and community research. And then we also have us joining today is Sarah Phones, who is the Grant Programs Coordinator. So she works on the day-to-day operations on the full life cycle of our program process, from initial application and review to funding proposal approval, payments are reported. So she's a wealth of information to kind of walk you through all those steps. Next slide, please. So learning objectives of this webinar today are to help you understand the purpose of the Community Sleep Health Grant and Public Awareness Grant, also to understand what organizations and types of projects are appropriate for this program, also what is needed to apply and how to apply, and then also how applications are evaluated and the ASM Foundation's grant management process if you do get funded. So without further ado, I'll kick things off with an overview of our Community Sleep Health and Public Awareness Grant. Next slide. And one more slide, please. All right. So the Community Sleep Health and Public Awareness Grant is open to projects focusing on improving sleep health and sleep disorder evaluation and treatment in the community. These projects can be either one-time engagements with the community or up to 2 years in duration. Projects targeting underserved or disadvantaged groups are of special interest, but they're not required. So some of the types of projects that we typically fund are those that include humanitarian service projects to improve sleep health in underserved or disadvantaged groups. We also fund projects that focus on the development, expansion, and dissemination of public and patient education resources or awareness campaigns to promote healthy sleep. And then the other types of projects that we also support are those that are implementation of evidence-based sleep disorders evaluation, diagnosis, interventions, or local community models for care of people with sleep disorders. Next slide, please. So this grant program, unlike all of our other programs, really does place a really strong emphasis on disseminating project findings and content that is developed as part of the project, as well as disseminating the project framework to enable others to replicate or expand the initiative. So while the ASM Foundation will share project results on its website, we do highly encourage project teams to outline their own methods for reaching specific audiences. There are a couple examples of dissemination methods available in a guide that we put together that is available as part of the funding opportunity, but it's truly up to the project team to choose the most suitable methods to maximize outreach as part of their application. Next slide, please. So in terms of who is eligible to apply, it can be individuals from charitable organizations with a tax-exempt status or individuals collaborating with a charitable organization with a tax-exempt status. Additionally, we can have applicants outside of the U.S. apply. But one thing that we do like to note for our international folks is that payment of grant funds must be accepted by the organization in U.S. dollars. So while there are not many restrictions on who can apply, we do have restrictions on the types of projects that will be automatically declined, and this is something very important to note. So these include projects that do not align with the focus of the Community Sleep Health and Public Awareness Grant, specifically research projects, and projects that are supporting ongoing operational aspects of existing programs, and also projects that don't meaningfully expand existing programs. So given this, we do strongly encourage applicants to check with the ASM Foundation staff to ensure that the proposed project is a good fit for the Community Sleep Health and Public Awareness Grant, and to ensure that it's not considered a research project because we will automatically decline it, or it's a project that will support ongoing operational aspects of existing programs or doesn't meaningfully exist programs. So those are automatic reasons for declining an application. Next slide, please. So this year, the ASM Foundation has budgeted to support up to 5 projects. Please note that these numbers are not final. Sometimes we don't get as many applications for some of our other funding opportunities that we have in the ASM Foundation. So this kind of gives us the flexibility to reallocate funding for grants for those that are most popular. And then we do have 2 different funding categories. So category 1 is for projects that are up to $50,000 and cover a period of up to 2 years. And then we also have category 2, which is for applications that are looking to get projects funded for up to $25,000, but in a shorter period of time, in this case, 1 year. One thing to note is that there are no restrictions on how you distribute the expenses. However, we do cap indirect costs at 8%. Next slide, please. All right, so now that I've given you an overview of the grant program, I'm going to discuss the application process. So this grant program, unlike last year, we are now offering it only once a year. So the application cycle opens up on June 17th, which is after our annual sleep meeting. And then we will accept applications all the way through the end of July, in this case, July 29th. Regardless of whether you get funded or not, notifications will be sent out to all applicants by October 31st. So a decision will be made and you'll be aware of it by then. So Sarah will cover this as part of the funding process. But one thing that is important to note is that we do allow up to 9 months for you to start your project from the moment you get notified that your project has been funded. So what that means is that the latest start date for your project could be July 31st of next year. Next slide, please. And then this slide here lists all the application forms that we request, and that includes a couple of different things. So the first thing that we request as part of your application is a face page with obviously your project title, who is leading the project, also the organization that is leading the project, and then also we need an official sign off from the organization leading the work and their administrative contact. We also ask for the project proposal to include the following, and that includes the need and population served, a plan for the project, how you might be evaluating your project, any plans for dissemination that you have, the impact the project will have on the population served, who is working on the project, and a justification for the funds requested. So we do provide a proposal template for this portion of the application component that you do need to submit as part of your proposal. And kind of like I mentioned a little bit earlier in my slides, we do have a helpful guide for disseminating your work that you may want to use and integrate into your project proposal. Finally, we also have a project budget outlining all the costs involved that you need to put in there, including, and then also we ask for your project team, we ask for CVs, bio sketches, resumes, whichever you have of everyone involved in the project. And also we give you the opportunity to provide any letters of support that you want to include as part of your proposal, which can come from collaborators of your project. So now that I've gone through the application process, Sarah's going to discuss the review process, funding, and post-award activities.
Okay, thanks, Vanessa. So I will give everyone an overview of our review process. This is applied to every application that we will receive for this program. So our Community Sleep Health and Public Awareness Grant Review Committee reviews every application that we'll receive. The review committee mandate and roster of those participating is here for your reference. For the 2024-2025 committee year, our committee chair is David Bishop, who's served on this committee in various capacities for many years. And then our vice chair and the rest of our roster is available here for your reference. Before we get into the process, I do want to touch on our commitment to a fair and objective review. So it's very important for us to avoid any bias or even appearance of bias. And with that goal in mind, our review committee members are asked to adhere to a very comprehensive conflict of interest policy and a confidentiality and non-disclosure policy, which ensures that all applications are evaluated on their merits. And additionally, there's no contact between the applicants and the reviewers at any stage of the review process. So everything is kept separate. So while this program doesn't provide research funding, as Vanessa mentioned, our scoring rubric uses the same anchor points as the National Institutes of Health. So if you've ever applied for one of their grants or been a scientific reviewer, then this will be very familiar for you. A score of 1 is considered an exceptional high impact application, and then all the way down to a score of 9, which is considered a low impact, non-competitive application. This scale just provides some additional guidance and context on these scoring anchor points, as well as how reviewers are asked to interpret them. So as you can see, a score of 1 is the highest that can be achieved, which is a project with essentially no weaknesses, all the way down to a 9, which is a low score. So reviewers are asked to evaluate each application on the above criteria listed out here, and along with an overall score for the proposal as a whole. Each of the scored criteria need an impact, project plan and evaluation, dissemination, and people and resources will each receive an individual score on the 1 through 9 scale. There are also 2 additional criteria that are not scored, but they are taken into account when the application is being evaluated. And this would be any concerns with the proposed participation of community members, patients, or other individuals, as well as the appropriateness of the budget. So once we have all of our scores and reviews completed, our next step is to prepare for our review committee meeting. So once the initial reviews are completed, our reviewer will make decisions based on the overall scores and critiques provided by each of the 3 reviewers for each application. And the committee chair will determine which applications will be triaged, which means they won't be discussed by the full committee due to being deemed a less competitive application. Additionally, for applications that are scored very, very highly in that very high impact range, those will only be briefly discussed as they are the ones that are most likely to be funded. For each application that merits a full discussion, we allot 15 minutes for each. And in keeping with that conflict of interest policy that I mentioned earlier, any reviewers that have conflicts of interest are moved to a separate room, online, a breakout room, so that they don't have access to the scores or any of the discussion. So once this committee review process is complete, how are the final decisions made? So the funding decisions really start with our review committee submitting final scores and final critiques after the review meeting. After the full discussion has taken place, reviewers can they can update any critiques and update any scores based on the discussion, and then that will be submitted back to staff. Staff takes everything that the review committee has provided, and for this program, they'll provide it to the AASM Foundation Executive Committee. Those individuals are part of our leadership, part of our board of directors, and they will review final scores, and they will make final funding decisions on which applications receive funding. So once that's completed, notifications are sent to all applicants as well as the organizational contact that you listed on your application. So whether your application is funded or not, you'll receive a notification so that you'll know what the outcome was. And your notification will also include the review critique forms and a summary statement if your application was discussed by the review committee. So, well, you won't see who specifically reviewed your application. You will be able to see the scores and the feedback. So you can see their critiques, and in the event that you do not receive funding, you can take that feedback and use it to improve your application. You will only receive a summary statement if your application is actually discussed at the review committee meeting. So if you're selected for funding, the AASM Foundation staff will work with you and your organization to get things started for your project. We have a few different components that need to be in place before we can execute the grant contract and issue our grant funds so that you can get started. So as a grant recipient, your responsibility is to first connect with the individual at your organization or at a collaborating organization that you're working with, who will be overseeing the administrative side of the grant. So that includes things like payment, obtaining IRB or IACUC approval if your project warrants it, and negotiating the terms of the contract and fully executing it. If you are at an institution and you're also collaborating with an organization for contract-related matters, we will need the information for the organization that is managing the funds, dispersing them for the various program activities, and overseeing anything administrative. So that could be your institution, that could be the collaborators, depending on the circumstances. But whoever is managing any administrative things, that's who we want to work with. If your project does require any kind of ethics approval, definitely make sure you begin working on that if you have not already begun to do so prior to submitting your application. That can be a more time-consuming process. And as Vanessa mentioned earlier, we allot for 9 months from the date of notification to actually start your project. So we want to make sure that you're able to get everything in place and get things started within that 9 months. And then finally, as far as your responsibilities as the project leader, go ahead and submit your foundation grant recipient profile form. This form is just used to gather information, to share details about all of our recently funded projects in various communications, including on our website. So for active projects, we do have several reporting components that we ask for throughout the life of the project. We require periodic progress reports, which are due for 1-year projects, they're due every 6 months. And then for 2-year projects, they are due every 12 months. Once your project concludes, all the work is done, you will have 90 days from the end of the period of performance to submit your final report. We will provide all templates and forms for you to complete your progress report, and those are also available for download on our website as well. As part of these reports, we'll ask for an update on the progress made toward your project, an expense report from your organization's accounting office regarding funds that have been dispersed so far and funds that are remaining to be dispersed, as well as copies of any publications, conference abstracts, posters, presentations, or any media that have resulted directly from this project. So for all reporting, it's important to work with your organization to make sure things are complete and timely. You may need to work with a different department to get financial information. So we encourage everyone to start the process early and make sure that you're staying in touch with them throughout the process. After your final report is submitted and approved, then we will work on closing it out. This is a pretty straightforward process. If there are leftover funds from your grant, then your organization is required to return them back to us. And on the other hand, if you have used up most or all of your grant funds, then we will issue a final payment. As part of the final report, all project leaders are required to submit key project outcomes of their grant in lay language. And this is something that we share on our website to make it publicly available. We'll also ask for any journal articles or abstracts that arose from the project. So we have an example here, just so you can kind of see the type of language that we request when we're sharing these project results. And so if you didn't get funded, there are a couple options. As Vanessa mentioned, this is a program that's offered once a year. So since we do provide the summary statement and the forms from our reviews, we strongly encourage that you review them. Sometimes there are things that may have dampened enthusiasm for your application that can be addressed and be changed. And you can use this information to make your application stronger and reapply again next year. The other option is there are other organizations to seek funding through. We are one of many, and as much as we would love to fund every application that we receive and support every project, it's possible we may not be the best fit. And sometimes there are other organizations that will be a better match for your project idea. We have time now to open things up for any questions that are in the chat.
Thank you. A couple of things came up. Sarah, do you mind putting that down that slide just so folks can see us? Okay, so I've been trying to answer some of the questions, but I just want to list some of them that actually came up that I already answered. One question that came up was, are reviewer scores revealed to applicants? So I answered yes, applications received, regardless of whether you get funded or not. You'll get the score as well as the critiques that the reviewers provided. So that information is helpful for you. If you don't get funded, potentially making your application a little bit more stronger for the next cycle that we open this up in the following year. Or if you do get funded, there may be some things in there that actually you may want to integrate into your research project that might be very helpful, but still doesn't take away from, your main purpose of why you're doing this project. So that was one question that came up. And then two related questions. Public indexing of existing and previously funded programs. I did provide a link for that, and that's on the answered section. So please take a look at that link. And then also a public index of publications or presentations or media coverage. So we do have that for closed projects. So that information is on there. You may need to scroll down to see where the community sleep health grant ones are that have been closed. And those are grants that have successfully ended. So I just want to point that out to folks. There was another related question. This is related to indirect costs. So the question is, what are indirect costs? And then also, if indirect costs are included in addition to the $50,000 budget cap. So Sarah, do you want to take that question?
Yeah. So the indirect costs are included in that budget cap. So your combination of direct and indirect costs cannot exceed the 50,000.
Yeah, so that would be like $4,000 if you do ask for the full amount that you would have an indirect cost, and then that leaves you with $46,000 remaining if you were to go for the higher amount. And in terms of things that you can include in your indirect cost, really it comes down to your organization. Obviously, it costs money to keep the lights on, and if you do have a grant administrator that's helping you kind of do the paperwork in the background, but obviously they're not involved in actually running the program that you got funded to do as part of the this grant. So that's an opportunity to pay for some of their extra time of being able to work on this project, specifically from the administrative perspective. So those are things that you can include as part of your indirect costs. All right. The other question that came up, and Sarah, if you want to answer this one, how many times can an applicant receive funding, and will the foundation support multiple concurrent awards?
So right now there's no real restrictions on how many times an applicant can receive funding. And we aren't necessarily opposed to supporting multiple concurrent awards, but each iteration of it would have to be a new application and it would go through the full process. So there's really nothing restricting it. If a program is carried out and is successful and there's additional work that your organization wants to do that also falls in line with this program, we absolutely would encourage you to apply again. We could not guarantee that it would be funded, but it would definitely be considered, as with, as all the other applications would be.
Yeah, and the one thing I want to highlight is that the project shouldn't be overlapping, so you can't submit multiple grant applications for the same project. But if they're different, they're significantly different from each other, then by all means, if it's the same organization that wants to apply for, getting funding for one of those projects that they're starting to initiate or meaningfully expand, by all means, please do submit an application. And then the other question that we got is, what is meant by concerns with community participation? Is there an expectation of an IRB local clearance when working with community groups? So I can answer this question. So some of the things that sometimes come up as part of our discussion when we review applications, some of the concerns might be specifically to the population you might be working with. So let's say if you're working on a project to promote sleep health in high-risk population, for example, folks who may have depression and may be severely depressed and may have suicidal ideation, there probably needs to be a plan in place of what happens in case, you do find that someone that actually got got and I'm just like, this is very like on high on the spectrum of like what could the worst that could happen, is successful in a suicide attempt. So those are things that you may want to consider is like specifically to your population, like what safeguards might you have in place? Now, we do not require IRB approval because this is not a research project. But if you prefer to have that kind of safeguard of having an institutional review board approve your project, by all means, that might be the safest way to go about it. So that's what we meant by concerns with community participation. And usually our reviewers are pretty good about kind of noting some of those things if they're not specifically specified in your application.
Awesome. Thanks, Vanessa. So, I mean, while we're waiting for any other questions to come into our chat, I know you had kind of touched on some of the application components that are needed. And one of them is letters of support. So can you make some recommendations on who our project leaders might get letters of support from as they're putting together their application?
Yeah, so you may want to consider if you're working with multiple organizations, and maybe this is like a collaborative project that you have, you may want to get letters of support from those individuals. If you do have someone who might be potentially providing like a technology or even something that is typically that is paid for, but they're providing it pro bono as part of your project, would highly recommend also getting a letter of support from them. There's no limit into the numbers of letters of support you can. I definitely do not get letters of support from your project personnel because that's a given. But if there are any outside collaborators that you are going to be working with, definitely do consider getting a letter of support. That's a good question. And then a question came up in the chat. It's would it still be acceptable to reach out to a member of this committee for advice regarding the appropriateness of our project? Sarah, do you want to take this one on?
Yeah, I mean, I would say if you have a connection with a member of this committee, I would say, they have a good understanding of how this program works and what kind of projects that we're looking for. So if there's something that you're considering, there's nothing stopping you from seeking their input. I also would encourage, though, to reach out to the foundation staff directly. This is what we're here for. We, want to make sure that you understand what is appropriate for this program, because we would hate for someone to put together an awesome proposal that unfortunately just doesn't meet this program. So I encourage you to reach out to us directly. We can have a phone conversation or talk over email or whatever works best for you to kind of go over the specifics and determine if this is something that falls into this program. But if you do have a connection with a committee member, they also have a great understanding, and they may be able to look at it and say, I don't know if that maybe meets the requirements or not. So there's absolutely nothing stopping you though from connecting with a committee member. The other thing I'll say is that if you do work with a committee member or know someone, they will not be a reviewer on your application. So You can talk to them about what you're working on, but they would be not participating in the review of your application so that we avoid any bias or appearance of bias.
Yeah, thank you for clarifying that. The other thing that I will note as well is that you might actually also be better off actually reaching out to past grant recipients. Those are all publicly available, and those are in one of the two links that I provided in the answered questions section of this Q&A, to kind of get an input of how they actually, put together the application. Especially if your project is kind of very similar to what they have that you're looking to get funding for, but obviously it's maybe at your organization or a completely different population that you want to be able to adapt it to. By all means, you can reach out to them. They're publicly available. So,
Um, Vanessa, there's another question in our chat that I will present to you. So this one asks, can you explain the type of research studies that would be excluded? Should the outcomes be community focused versus individual?
so straight up research projects, examples that come to mind are just your traditional like clinical research, comparative effectiveness projects. Population based research projects would not be accepted. We have different mechanisms for that, and we actually have an entire like suite of 8 different programs for that. So they may be better suited for that. I will say the only exception, it's not clearly indicated in the request for applications, but the only exception would be like a community-based participatory research project, because it could be both a research project, but it could also be a community-based research project, especially if it's going to inform some of the work that you may be developing as part of like phase 2 of the application that you put in. So if maybe like the first year is really like it does require like you to get information about the population to understand what their baseline is, start developing an intervention, and then actually being able to implement it in practice. The second year, those are the types of, the only type of like research, community-based research project that we would potentially fund. And there are several examples. Again, I highly encourage you to go to like our project results and past funded projects page, because it gives you a good idea of like what those types of projects would have been that are, have a little bit of a research flavor, but definitely are more community focused.
Awesome, thanks.
All right, Sarah, I do have a question for you as we wait
Okay.
for others to come up. So one question is, who qualifies as project personnel?
So this is really at the project leader's discretion. So, we define for all of our programs, project personnel are defined as anyone who's contributing to the execution or work of this project in a substantive, measurable way. They don't need to receive compensation as part of it, but anyone who is making a significant contribution to carrying out this work. So that's really at the project leader's discretion of if someone's contribution is significant enough for them to qualify as project personnel. If they're only involved in one small aspect, that may not be significant enough to qualify. But if there's someone who's really working and carrying out throughout the project period, then the project leader might deem that is someone who will qualify as project personnel.
Awesome. Thank you for explaining that. The other question, I think this comes up more so like after you get the grant funded, but it's important to discuss because I think we want to be very transparent, is what happens if I need a no cost extension on my project? Let's say I did get funding for like the 2-year period, but then it turns out that I will need that additional year. How do I go about requesting it?
Yeah, so no cost extensions can be requested at any time while the project is active. And they do need to be established prior to the end of the period of performance. And the end of the period of performance is different than your final report due date. So final reports are due 90 days after your project period ends, which we do to allot time to finalize budget, finalize outcomes, finalize everything. But your project period of performance ends before that. So we always want to make sure people understand that if you do need a no-cost extension, you have to establish it prior to that performance period end date. We also recommend, I mean, you can submit it anytime, but what I would recommend is submitting your no cost extension request along with a progress report. So if you're coming up on your 12-month progress report, you have a 2-year project, like Vanessa mentioned, and coming up on your 12-month progress report, and it seems like you might need more time, submit them both at the same time. We do need a progress report to go with your request. And so you can kind of do both things at once. And that's just more efficient for you, your organization, foundation staff here, our leadership. It can all be reviewed at once. And then in addition, we would just need a request letter from you and your organization signed by both, indicating your plans for the additional period of time and just kind of the reason for why you're requesting additional time. But yeah, this comes up pretty frequently. And it's typically something that is mentioned in the contract as something that's an option to request. But the main thing is that we want to make sure people understand it has to be established by the end of your project period. So the final report is 90 days after that.
And we'll send you plenty of
We
reminders
do.
when your project period is coming up, and that you have to, if you are thinking of a no cost extension, that you need to submit it before then. So
Awesome. Yeah, we do have a few more questions in our chat. So the first one is, if you do a community-based participatory project, do you still need to partner with a community organization, or could you include a member of the community advisory board as the community organization? Vanessa, I'll let you take away this one.
you could do both. And your organization, if you're applying through your university, more than likely they already have like the nonprofit, believe it or not, qualification. So technically that qualifies you as a community based practitioner to apply for the program through your university. But if you are going to do this, you have the option. I mean, I would highly recommend both options. Either you partner with a nonprofit organization, let's say if it's a patient advocacy group, have someone have the organization be part of your project, or if you set up a community advisory board, making sure that there is like, and again, assuming that this is like a patient related project, having the patient's voice represented in your project will be really beneficial, and will definitely meet the goal of the community sleep health grant. Good question.
Thanks. And then similar along those lines, are projects from the Department of Veterans Affairs eligible to apply?
So they are eligible to apply, but given that you are a government entity, you do need to partner with a nonprofit organization to do your work. So kind of similar, like if you are if your project is focused on patients, partnering with a patient advocacy group would be a requirement for you.
And then I can take this last one. Regarding project costs, personnel, materials, infrastructure, what is the general thinking about what costs are reasonable to request? So we don't have really restrictions on what you can include. A lot of the direct costs that we tend to see are things like salaries, that's eligible to request, equipment, supplies, any travel, any plans for publications. So if you are planning to submit an abstract to an upcoming meeting, that abstract fee would be something that you can budget for. So there aren't really too strong of restrictions. You have your opportunity in your budget justification to explain what these costs are for, why you're requesting it, why you need that amount, and what your plans are for that. So there's nothing that is like an absolute hard no. But you have the opportunity to explain everything that you're requesting in the budget. And we have another question. Do I have to finalize the nonprofit status before I apply? Or if we are near completion, am I still able to apply?
Yeah, as part of the application, that's eligibility criteria. You do need to have the nonprofit status coming in. But if you want to discuss a little bit further about your situation and maybe potentially, seek an exemption, we're flexible with that. And that's one thing that we also want to know, like, our eligibility criteria and ineligibility criteria are posted. But if you have any questions about it or you have a particular situation that maybe you want to discuss through, please reach out to the foundation staff. And similarly, like what if you want to talk about your project, we cannot give you input on your project because that's part of the application process, and that's why we have like our reviewers looking at these projects. But if you're wondering if this project would be something that could potentially be support aligns with the goals of the program, please reach out to ASM Foundation staff. You can reach out to us. The sleep meeting is coming up, so we're kind of busy, so it may take a little bit of a while, but we do have office hours that we can make available to you to discuss some of the projects. But more than likely, once the application cycle opens up, and maybe the week after the sleep meeting, our time will open up a little bit more, and we can potentially discuss. So you kind of at least know ahead of time whether it's if you want to apply, if you're eligible to apply or not apply.
Or you can swing by and visit us at the sleep meeting because we'll be
That is
there too.
true.
So
Yes.
swing by and chat in person.
Yeah.
Um,
So we'll be in two
yeah.
locations at the sleep meeting. If you are attending the sleep meeting and you want to talk about, the community sleep health grant, Sarah and I will be at the ASM Foundation Oasis. So that information of exactly what room number we're going to be in will be there. You can also swing by in the exhibit hall, though there will not be any program staff, but we will have our director of development there. He's pretty good about being able to, answer some of the questions that you may have, or he may ask you to come swing by the ASM Foundation Oasis. But we'll be around for questions. And if not, definitely just set a meeting with us.
Absolutely.
Okay.
All
I
right.
think I think we can wrap up. So just really briefly, if Sarah, if you want to bring up that last
Mhm.
slide, just want to thank everyone for joining us today. You guys had really good questions, more than we usually get for this grant program, which is exciting. We love to fill out those questions. Um, so as a reminder, today's webinar is recorded, and we will be sending it out to everyone that registered for the webinar in the next couple of days. Again, the application cycle for the Community Sleep Health Grant opens on June 17th and closes on July 29th. The other plug that I'm going to make in, which is really nice because we have an upcoming Sleep Grand Rounds webinar, which is actually going to feature Dr. Justin Fiala. He is a past recipient of the Community Sleep Health Grant, and he actually got funded to start up a free sleep clinic that he was able to do as part of the Community Sleep Health Grant. So it kind of gives you a flavor of like what he was able to actually do through this grant funding, though he will not be able to answer questions directly to the grant program. That's what we're here for. But this is as one of the things that we're doing as part of our dissemination of our projects. So it's nice to be able to for you guys to have a resource of what our grant recipients do as part of their project and the impact that it's had on the community. So more information about this grant program and others, definitely visit visit foundation.asm.org, or sign up for a monthly newsletter by visiting the Contact Us page. And then, like I mentioned earlier, and like Sarah mentioned earlier, please don't hesitate to reach out to us with any other questions you might have, whether if you're attending the sleep meeting or you want to schedule some time with us. But on that, have a great afternoon, everyone.
Thanks, everyone. Bye.